Shane Lynch is on the show today. So we're going to warm up a little bit before that. We're going to talk about some uncomfortable things. Could be squirmish, but you'll have to handle it. You're all adults. Sit down. We have to talk about some embarrassing health issues that leave us asking, is this normal, as this sign says? Please welcome with all the answers, Dr. Melissa Hershberg. How are you?
Thank you.
We had a lot of emails when we put it out to everybody. They were like, okay, we've got to ask some questions and get some answers. Because I think what we do is we compare things that are happening to us with our friends, and we don't really have the answers, right?
Well, we look on the internet.
We look on the internet.
And think we have everything.
And you know what? That's not always the right thing to do,
No,
is
Dr. Google can be very scary.
Okay, don't do that. Very scary. Okay, first of all, number one, from Amanda from Kelowna, she writes, chin hair. Told ya. Don't get uncomfortable here. Just before my period, I sprout thick hairs on my chin. Why does this happen? I can live with the thin white hairs, but the dark ones are getting annoying. Are you relating to this, anyone? And why is it in just one spot? Okay, with all the answers, Melissa.
All right. So chin hairs, very common, very normal. So typically when it happens at a young age, like in our 20s and our 30s, it's a result of a genetic predisposition.
Yeah.
Certain ethnic groups tend to have darker, coarser hair, and that's just natural. It can also happen during times of hormone fluctuations, like how she said prior to her period. So prior to our menstrual cycle, after pregnancy with breastfeeding, or in menopause, these are times when our estrogen levels can drop. And as a result, our male hormones, our testosterone, is higher relatively, so we can get more of a male patterned hair growth. That being said, if you have a lot or the pattern's really different from you, before you talk to your doctor, because it could signal something more serious.
Is there a solution?
Yes, there is a solution.
Okay,
so,
solution.
First of all, what not to do, don't shave, because that will just make it grow in, thicker and coarser. So instead, use a more gentle method. If it's just a few coarse hairs, tweeze, or you can do electrolysis. If it's more, then waxing or laser hair removal is really good.
Okay, now the next question, nipple hair.
Yes.
I told you.
Yeah, nipple hair.
We've got to talk about it. Let's talk about it today.
All right, so nipple hair, obviously it's something we're a little bit more embarrassed to talk about, but again, very common, very normal, and it's something that a lot of women actually ask their gynecologists about. And again, more common if it's young, it's a genetic predisposition. Certain ethnic groups, people from Mediterranean or Middle Eastern descent, it's more common. If, however, you're noticing that you're getting the nipple hairs associated with other symptoms like irregular periods or weight gain or acne, it could be a sign of something called polycystic ovarian syndrome, which is just when your hormones get a little out of balance. So definitely talk to your doctor about it.
Is that it could be problematic in the long run?
It could be problematic. It could lead to more difficulties with fertility, but it's also quite treatable with lifestyle or diet or with medication.
And how would they resolve that problem, perhaps?
Okay, so if you've got, a few nipple hairs, again, you can carefully pluck them, or you can cut them, or you can do electrolysis. Or if it's due to a hormonal disruption, something as simple as the birth control pill or another medication that would decrease the androgens, the male hormones.
Would be like a low dose on that? Low dose on
that?
Yeah,
low dose pill.
Yeah, okay, all right. Ingrown hairs. Come on, we all got those.
Yes.
Why do we get them?
I know. Ingrown hairs, they're a nuisance. They're very common. And the reason they happen is typically in coiled, coarse hairs that have been previously shaved. They grow in and they get stuck in the follicle or in the skin, and so you get irritated, inflamed skin around it. So they often present as red bumps that can occasionally have, pus or darkening of the skin around it. So basically you want to prevent them. And where they often occur is areas we shave. So for women, often our bikini line or our legs. For men, they can get quite severe ingrowns in the facial region.
So what do you do about that?
So prevention is key. So what you want to do is avoid shaving. Use a gentler method, wax, or you can use a laser hair removal and exfoliate. And if you do get an ingrown hair, there's things you can do at home. So use a warm compress, which will bring the hair to the surface, and then you can tweeze it out. But if you notice it's becoming more painful, or it's getting bigger, or it's starting to look like a boil, see your doctor, because you may need an antibiotic or a steroid, or even a little incision.
Sorry, this is, okay, we're talking, I'll just bring it on the table. What's a boil?
So a boil is essentially just an abscess or a localized infection under the skin.
Okay, all right.
Yeah.
All right. Now, let's talk about hair down there.
Hair down there, yes.
A lot of people like complete removal.
Yes.
Some people like a little removal. Some people have a lot and they want to get a lot. What's the norm?
Well, there you're saying, it's all about individual preference and what you are comfortable with.
But there's a purpose for that hair down there.
There is a purpose. So one thing, it prevents friction during intercourse, and also it does help prevent certain infections. That being said, if you are not comfortable with it and you want to remove it, you do run the risk of, if you're waxing, getting a burn or getting an infection. So just be careful and make sure you go somewhere reputable.
Okay. All right. Here we go. Well, that's out of the way, but there's more. Here we go. There's always more on the show. Okay. So Rebecca from Newmarket, Ontario asked this question. I have these weird red bumps under my breast, right where my underwire bra hits. I changed my fabric softener. That was a good process of elimination. Tried different fabrics for my bras, applied moisturizer and antiperspirant on a hot day. They just don't want to go away. So I'm a double D. So going without extra support is not an option. Is this normal?
Okay, so again, very normal. And it sounds like what she's describing would be something called intertrigo, which is an inflammation or a rash that we get in skin folds like under breasts, especially under larger breasts, in the armpit region or in the groin, because these are areas that trap moisture. And when you have perspiration and moisture, you're more likely to get bacteria growth there or yeast growth, which sounds like what she's describing. So if you get little red bumps or if it has a red rash that has a bit of an odor, it might be that intertrigo with yeast. So you can try, the most important thing is to make sure you keep it dry. So after you get out of the shower, if you've got large breasts, you can lift them up, put the hair dryer on
dry away.
Yes, on a low. Exactly, on a cool setting, and keep it dry. And then you can put on a baby powder.
Yeah, that's right.
Make sure you're wearing a good supportive bra so that the breasts are lifted. You can even wear a cotton bra at nighttime. And then if it is a yeast infection, talk to your doctor. You can get a topical anti-yeast cream. Red bumps can also appear on other parts of the body. And one area that is very common that people often mention is they get these little tiny red or white bumps on the arms that are really rough.
Right.
And that's a really common condition called keratosis pilaris. And it can be difficult to deal with and treat. But one thing that can be helpful is talking to your doctor about a vitamin A acid cream.
Does that happen at a certain age, or is it a change in hormones? Why does it happen?
Yeah, it actually tends to get better as you get older. Okay. And again, it's just a big, it's a genetic predisposition. So if your mother had it, there's more of a chance that you'll have it. And it's just a really rough rash that might bother you in appearance. It's not dangerous.
Right.
But it's a common cause of bumps that people often mention and wonder, what is this,
You think we're done? Oh, no. We've got more with Melissa right after the break. We'll be right back. Well, Dr. Melissa is back. We're talking about embarrassing health issues, and this time around for men. And Natalie from Brampton, Ontario, asked this question. She says, my son, who is 17 years old, is suffering from back acne, and he eats junk food. Okay, because he's 17, that's why. Could it be the food or the shower habits? Does he need a special scrub? So that happens a lot. Why does that happen?
Okay, so acne on the back, or backne, as people like to call it, very common, especially in teenage boys.
Yes.
Why? That's a time when testosterone levels are going crazy, they're increasing, and testosterone increases oil production. And when you combine this oil production with bacteria, the result can be acne. And the back is an area that we often don't, especially boys, don't wash as much. As you wash your face, you don't wash your back. And then you can also wear tight clothing, which traps perspiration, and the result is acne.
Right.
So solution, absolutely diet can play a role. There is evidence that a low glycemic index diet, so one that focuses on fruits, vegetables, whole grains, all the foods that teenage boys just love, does help, right? And then cutting back on the sugars and cutting back on the trans fats. If the acne is getting worse, you can talk to your doctor about a medicated backwash, something that has benzoyl peroxide or an antibiotic. Or if it's really bad, then an oral antibiotic or even a drug called Accutane can be extremely helpful if you're insecure about it.
A lot of people are wary about Accutane because of some stories that we've heard in the media.
Yeah, but if it's used correctly, it can just really do wonders.
Now, when you are scrubbing your back, you can't scrub it too much because that could irritate the acne as well. So what do you suggest, like a long cloth or something to get the back?
Like a long cloth. You don't want to use one of those exfoliate it too hard because then, like you said, it can bleed and it can lead to an overgrowth of bacteria or infection.
Okay.
Just a washcloth and using that medicated wash is helpful.
We, summertime especially, we slip on our shoes.
Yeah.
And we don't use those little socks to absorb. And then we smell our shoes, or at least I can smell the shoes from like a mile.
Yeah.
For smelly feet.
Yeah, smelly feet is a big problem, and you're right, especially in the summer.
Yeah.
Like acne, it's the same combination. It's the fact that we sweat on our feet, and the bacteria, they love the sweat, and then they produce that characteristic odor. So the key is you want to prevent your feet from sweating. So you want to try to keep them dry. So you can use a baking powder or anything to or cornstarch, anything to sort of keep them dry.
Yeah.
Change your shoes up. Don't wear the same shoes every day. Try to let them breathe. Try to, not wear shoes with bare feet. Try to use a
They've
sock.
got these little socks that you can wear.
Yeah, you can wear
For
something
guys
like
too.
that.
They've got skulls on them. You'll love them.
And use a good quality shoe. Like obviously if you're going to use a synthetic or a plastic shoe, you're going to sweat a lot more. Now, if you do wear the same shoes and you do everything wrong and you get the odor, there's stuff you can do at home. Also, a simple solution is just baking soda and water. So you can just soak your feet in that, for 15 minutes at nighttime.
Warm water, just for 15
warm
minutes.
water and just,
And what's that going to do though? What's it going to just?
It just helps neutralize the foot odor.
Okay.
It just helps neutralize. Yeah. You can also try putting a little bit of lemon in there as well.
Right. This is turning into smell-o-vision. Did you get that? Thank goodness not on this one. Thank you to Dr. Melissa Hershberg. Thanks for all that information. We have to take a break. We'll be right back.